Okay, so we have talked a lot now about helping learners with motivation. We just wanted to briefly cover what if there is a more serious problem. So if you've tried these strategies and learners are still telling you that they really are having trouble, they're really struggling, and it's super tough to get motivated or to get started, or even maybe to get up in the morning or things like that. So we want to know if they need extra supports, and that would be if TLG needs to set up a referral for them. So a couple of ways to understand what's happening is to listen and ask, how long has this been going on? The general rule of thumb is that if someone has been struggling a lot with daily functioning for 2 weeks or more, they probably need extra supports. That's my next point. How is it affecting functioning? So by that, I mean, can you still do your normal everyday things, or are those things really interrupted by how you're feeling? Again, if they're really interrupted, then that's a sign that extra supports are needed. So we're basically talking about mental wellness and mental illness issues, which are really common, but they're not diagnosed the way physical illnesses are diagnosed, because we can't take an x-ray and look inside someone's mind and see what's happening. The only ways that mental illnesses are diagnosed are through the symptoms. So what is happening? The severity, how bad or how much is that feeling? How much is that happening? The duration, how long has it been going on for? And like I said, two weeks or more is a kind of a flag. And then how much is it affecting functioning? These two, depression and anxiety, are the very most common. And when I say common, I don't just mean common inside of mental health issues. I mean common in the population, extremely common. So, and it's a spectrum. So if someone says they're feeling depressed, that doesn't necessarily mean that they need immediate counseling or assistance. One day they might be feeling low, and then maybe the next day not so much. So it's mild to severe and everything in between. But I've told you about how if it's going on for more than 2 weeks, probably needs a bit of help. Again, we're not mental health experts though. So what we have to go on is just what we're told and what we can see. And asking questions is great, but in general, a learner will probably decide whether they're going to disclose something to you or not. What can we do if they do disclose something, if they're struggling? So we can definitely listen and empathize. Now, we do want to maintain our professional boundary as an educator, as a tutor. And at the same time, we don't want to push someone away who's reaching out for help. So this is a fine line to walk. So what we want to do is listen enough that it shows that we care, because we do care, but not let it become the total conversation for the day. I'll give an example. If I say to you, I'm really struggling, and you say to me, you know what, we really don't have time to talk about that. We need to focus on your work. That doesn't feel good, right? But if I say to you, I'm really struggling, and you say to me, okay, tell me more about that, I already feel that there's an opening for me to talk to you, and I can be sure that you're listening, basically. Empathizing is the same as you would empathize with anyone's difficult situation. I mean, you would say, that sounds hard. It sounds hard to deal with what you've told me. Validating refers to saying those kinds of feelings are okay and they're common. A lot of people feel that way at various times. It's reassuring to know that they're not the only one that feels this way, or that they're not experiencing something extremely rare. I have some phrases that I pull out when these kinds of things crop up, and they do tend to crop up when you're not ready. So like, when are we really ready to hear someone struggle? So I call them my back pocket phrases, and they're things I've just memorized to say that sort of blanket do all these things. They show that I'm listening, they show empathy, they validate, and they reassure. As well, you want, and I'll show them to you, in the next slide. As well, you want to show confidence in the learner. It is great if they tell you something, because it means that they trusted you and they're confiding in you and they're looking for help or resources. So that in itself is a strong thing to do. So you can tell them that. And then there's two ways that this can go. One is, if you're not sensing that extra supports are needed at this time, if it's a, sort of a mild problem, or it's just something that's happening right now but not yesterday, you can definitely redirect them onto their schoolwork. And the way I usually do this is by saying, I know that getting down to work and getting something accomplished can make the day turn around and make, all the difference. Sometimes it makes you feel better. Another tutor suggested to me to say, hey, I have a gift for you, which is that let's focus totally on schoolwork and take your mind off whatever it is that's happening just for a little while. I thought that was a great suggestion. But the refer, which is also on the slide here, that referral piece is up to the TLG staff because they are the trained employees of the literacy group. So if you are thinking that someone needs extra supports, if it even crosses your mind, then they probably do. And that's when you'll go to your coordinator and you'll let them know. You'll also let the learner know that you're going to talk to your coordinator and get some extra supports for them. I'm going to show you those back pocket phrases. So these are the ones that I said I've memorized, and I use them in almost any situation when a learner tells me something that's hard. I'm sorry to hear that. I hear you saying that, or tell me more, in order to, just bring out, if they've only just said, I'm struggling, I need to know exactly how much. And then that must be hard to deal with is a way to empathize. It's good that you are talking about this is a way to show confidence in them and to reinforce that they're strong. And I can see that you are strong. There's one more thing I wanted to just mention. I'm just going to go back to the last slide. It was about the referral piece. So one more thing about the referral piece. What if the learner says to you, yes, I'm having a really hard time, but I don't want you to tell anyone? What should you do? Well, it's the fact that the learner has signed a confidentiality agreement when they started their learning program that gives TLG permission to intervene on their behalf. It's really important to keep everyone safe, and we want to make sure that learners are supported. A nice way to handle this with the learner is to just explain to them that we need more information, that I don't want you to have to deal with this alone. I'd like to see you getting help with this, and there is always help available, and especially help to find out more about what's going on. But you do need to make it clear to them that it's your responsibility because you have to keep them safe. So it's your responsibility to report it to the coordinator, and then the coordinator will be in touch with them with some supports. So that's what you're doing. That's all. Your job is to then turn to your coordinator for that help, and the coordinator will take care of it. It's not your responsibility as a tutor to take it any further than that, because your role is to support the learner in learning. And let TLG take this piece and do this part for you. Definitely. There was one question when we did this training as a workshop. Someone asked, what if I have a health contact in the community and I could refer my learner to that person because that person is my friend, or they're my own doctor, or there's someone who I really feel might be able to help the learner, and maybe even at a reduced cost if it's a kind of therapy or something that has a cost involved. The answer to this is that TLG will still want you as the tutor to tell them first, to contact them and to talk it over with them before you do anything else, partly because they want to make sure that they're staying within their mandate to serve the learner in the best way possible, and partly because TLG will get, it's like recognition for referrals. So they also want to be part of it. It's a win-win situation when a tutor can bring great resources like that to an organization, but the organization also has to be part of it in order for everyone to be on the same page and in order for everyone to benefit. Okay, so this is just the shortest list possible of information about where learners can get help if they're struggling. But I have also created a handout or a resource with a list of phone numbers, hotlines, online counseling services. So I'll make that available to TLG, and then they will put it on their website. But again, it's not up to you to do the referring. It's just so that you know that these things are available.